for both of these therapies, people are familiar with massage, where people might move their hands around, and maybe you might be familiar with deep tissue massage, where there's really a considerable amount of sort of, just pressure from the fingers of the hands, or from the elbows, or whatever it is that you're touching this person with. But a light touch therapy uses a very, very gentle touch. It's almost often about the weight of a nickel. And what that does is, for one thing, when your hands hold something and they hold them with a bit of pressure, you have actually several different subtypes of your sense of touch. And what's called the haptic sense, which is like the holding sense, tends to overwhelm some of the other senses. If you touch people lightly, you get much more information about things like temperature and heat and vibration. Temperature is heat, but heat, vibration, fluid flow, much more subtle signals, and those are really important for dealing with the body, because a lot of the changes that are going to happen in the tissue are going to be these very, very subtle changes. So simply using a heavier touch actually makes it so that you can't perceive those changes as well as you might otherwise be able to. So that's one really important aspect of the light touch. And the other is that people can be in kind of a vulnerable place with this, and it's all very gentle inquiry, and the whole way that you end up, kind of holding the space for somebody is being very, very sensitive to some of these changes that are going on. And you don't want to, in that state, kind of push people. And when you use a harder touch, people will tend to respond with guarding. They'll tend to, feel pushed in one direction or another. So that whole, the ability to hold the space actually depends on a light touch. And so that's one of the other reasons why it's very important. So it's a kind of a different philosophical structure, but it's also, it's based on these very, very subtle signals, which, otherwise you'd just stamp out.